everyone. I just want to start this video by saying I won't be discussing anything about price or insurance or anything like that because I really don't want to give false information. I mean, I am 17. I didn't pay for this. Obviously, my parents did. So if you really need to know about that, I mean, leave me a comment or message me on Facebook or find my support group, whatever. I will leave the links for that in the description. And I can try and answer your question and give you better information. And one more thing is, I know people were kind of annoyed with all the hype about Dr. Sinervo and whatnot, but he really is a great surgeon, and I just want you to know that I'm not saying you have to go to him or he's the best surgeon in the whole world, whatever. There are plenty of great endo excision specialists, and I am just sharing my experience with him because I have been asked by a lot of people to do this, and have had to type it out a couple times, so I'm like, why not make a video? Okay, so to get started, you actually have to go online and fill out a patient packet, and it's not like one of those, I mean, it's really thorough. You write like your story almost, how it affects you, your daily life, I mean, how it affects everything in your life, and just what medications you're on, just all of it. It's not just like rate your pain on a scale of 1 to 10, you know. It's not that like simple. It's so much nicer, and he goes through the whole thing, reads through it, and within a week or two he'll call you right on the phone. And I mean, he didn't just talk to my parents, he directly called me, and that was amazing for me because I'm used to doctors treating me like I am a 2-year-old who can't even speak and trying to explain everything to me like I know nothing. So it was nice for him to kind of treat me more like an adult through this whole process, and he told me he could help me, and I was so happy. I was ecstatic. I had a bad experience with surgery before him, and it took me a month or two to recover, and my pain continued to get worse, not better at all. So when I got this call from him, I was just extremely excited, and he scheduled my surgery for October 10th, and we drove we drove up there from Florida to Atlanta, and it was probably, I'm not sure how many hours, a couple hour drive, and so I was pretty scared for that because with my first surgery I would not be able to go home. I could not get in a car for a month after, so I was very terrified. But when I got there, he assured me that this was going to be easy, I could go home in a few days, you know, and I went to my pre-op appointment, and it was actually pretty simple, and I was really nervous and scared, but his staff was really sweet, and so was he. He did a quick pelvic exam, which usually caused me to flare, and it did, but it was very gentle. He wasn't like, you know, like those doctors jabbing you and all those horrible experiences. Like, I can't take that. But he was really great, and he answered all of my questions, all of my parents' questions thoroughly, and talked to me, like, you know, straight on, and didn't just talk to my parents. So that was wonderful. And I participated in a study for endo even, and they asked all the patients to do that. I'm not sure if it's still going on or not. And he got all my testing done, and it was just really quick, really easy. He gave me my bowel prep, and I literally hate bowel preps. Usually that is the worst part of surgery, and I'm sure all of you know that because for most it's pretty bad. But he actually gave me Miralax, and I was a little confused because it's like a daily thing I usually use, but it was really easy. You just do the full bottle of Miralax. I'm sure for some people it'll be different, but this is the basic bowel prep he said he usually gives everyone. And so it has relatively no taste, so it really wasn't that hard. I just drank the whole thing. It didn't go that bad. I mean, of course it was painful at the time, but it was, you know, it was a lot easier than I thought it was going to be, and it worked, so that's great. And the next day I woke up really early, had to get to the hospital by 5 a.m. And when I got there, the nurses were great, you know, they didn't rush anything, they were really thorough with everything, checking everything, you know, and they gave me anxiety meds and, you know, kept me calm. And before surgery, Dr. Sinervo came in and he prayed with my family. It was amazing. He prayed and he held our hands, and he got his staff to pray with us. It was wonderful, and the nurses were wonderful. And I even had my teddy bear with me because I was so scared. So he actually dressed up my teddy bear. Well, the nurse did. They dressed up my teddy bear in scrubs with like a little tape where my incisions would be. I actually have him right here. He's pretty worn out, but I love him. My boyfriend got him for me. And he let me actually take the bear into surgery with me. So as I was being rolled into surgery, I was so scared. But he was holding my hand the whole time, all the way down the hallway, all the way to the operating room, up until the time I was put to sleep. He was talking to me, and he was reassuring me that everything was going to be okay. He was holding my hand and stroking my hair and just looking me in the eyes and keeping me calm as I went under. And I mean, that's how I remember going to sleep, and it was so much better. I mean, I felt like I was in the right hands. It was amazing. And I woke up in quite a lot of pain, but it really wasn't too bad. They got it under control pretty quick, and he told me, he came in that night, told us kind of, what he saw with my surgery. I got excision of endo, and adhesions, and I had an appendectomy and a pre-sacralorectomy where they cut the nerves to your uterus, which actually I highly suggest because it really worked out really well for me. And he removed everything, and he did a really thorough job. I had adhesions that were infected with endo, connecting just about everything. My ovaries were connected. My ovary was connected to my bowel. My bowels were being pulled out of place almost everywhere. It was just twisted, and I had adhesions just almost everywhere. I had scar tissue like on my appendix. It was a disaster. I have the pictures as well, and all of these pictures from my surgery with the bear, with my surgery with Dr.Sinervo, everything is posted in my social media, and I'll list those below, like my Instagram and stuff. And he told me, and I was really scared. I started crying. I was terrified, but then I realized that he fixed it. I know there's no cure, but he did a really good job, and I was up and walking the day of surgery. Like, they had me walking every hour, whatever, and by the next day I was walking around every half hour. And they sent me home the next day. I stayed overnight, sent me to the hotel, and we only stayed one more night in the hotel, and then we went right back to Florida. And to be honest, the car ride wasn't that bad. I thought it was going to be horrible, and I mean, it was not that bad. I had my abdominal binder that he gave me after surgery, which I highly recommend having after any female surgery now. I mean, it was wonderful. And you can wear that as long as you want. I wore it up to like 2 weeks after surgery. And he reassured me that, surgery, it was, even though it was pretty extensive, I can't talk, even though it was pretty extensive, my recovery was supposed to be quick, and I was kind of in disbelief, just because I'm not used to that. I'm used to, me personally, it takes me a long time to recover from surgery because I'm very sensitive to drugs and lots of things, especially when they put you under. The drugs that they give you, I'm really sensitive to that. So the only thing that was really affecting me was the anesthesia, and the pain was very minimal. I mean, he gave me probably, 60 Percocet or oxycodone. I think he gave me both, and I didn't take that many. I think I took maybe 10, and that's like nothing for me. So the pain was very minimal, and about 3 days after surgery, I felt almost 100%, to be honest. I was very sore, still trying to, I wanted to do everything. I wanted to, go on the beach and start running and jump in the pool and whatever, but I knew I was supposed to take it easy, so I was kind of trying to, do what I was supposed to do, even though I felt wonderful. And after 2 weeks, I was completely back to doing all my activities, but even better than it before, because I was in pain, so I could do just about everything. And I mean, a lot of people ask about the incisions and whatnot, and they were very small. They healed very quick. He did the 2 lower incisions very low. This, my first surgery, my doctor put them up on my stomach. He thought that was crazy because, and you don't have to. So he did them very low. They're under my underwear line. So those worked really great. They healed really fast, and everything seemed to heal really great. The only thing that was really bad about the experience was the anesthesia, which probably made me a little weird for about 3 to 5 days after surgery. But other than that, my pain was completely gone. And since the surgery, I haven't had one endo flare up. I haven't had one little bit of pain from endo. I still have pelvic floor dysfunction, so I do have leg spasms from time to time, and I get some stabbing pains in my vagina and whatnot, but I have no cramping, no stabbing my uterus, no stabbing my ovaries, no pulling, none of that pain and none of those flare-ups. I no longer have flare-ups, and it's amazing. And I just started physical therapy. I'm about almost 5 months, I believe, out of surgery. And I'm already in 25% control of my muscles. So I'm doing really wonderful. And hopefully after physical therapy, I'll be 100%, no more pain at all. And I just can't thank Dr. Sinervo enough for this. I had a wonderful experience with him, and his team was extremely thorough, and so was he. He was wonderful. I could call him at any time to ask questions. I could message him on Facebook. I could message his some of his staff on Facebook even, because they're in the support groups. I mean, it was amazing. He was wonderful. He was more like a friend than a doctor, and my parents loved him, and he did such an amazing job. And, you know, I know that people freak out because it is pricey, but it is way more worth it than having surgeries every year or every 5 years or whatever and taking all these pills, because if you're going to spend a lot of money on one surgery and have it be pain-free the rest of your life, I mean, that adds up. Like, that's so much better than spending money constantly on other stuff. And I'm not saying you have to go to him at all. I'm just saying that if you really do need the relief that I did, and you're really in pain every single day, and these pills aren't working, and these hormones aren't treatments aren't working, and going to normal gynos isn't working, I highly suggest you find an amazing excision specialist, because, you know, there's a lot around the U.S. There really isn't that many in the world, but there is a few, and if there's one near you, I highly suggest going to them, because it can change your life. It changed mine, and I am back to being a normal teenager again. I thought I was never going to say that. I mean, I didn't even plan for college, because I was like, oh, I'm not going to go to college. I'm probably going to be stuck at home in bed all day for the rest of my life, and I'm not, and it's amazing and wonderful, and I am so grateful, and I want to pass this on to as many people as I can and help as many girls as I can, and that's also why I created the support group Teenagers with Endometriosis. So if you're a teen and you're having a lot of pain or symptoms similar to this, go ahead and join that group on Facebook, because anyone is welcome that is a teen, and there are no doctors or adults, so it's judgment free. I mean, I highly suggest, and there's a couple other support groups I really love, and I'll post all of those in the description along with all of my social media. And if you really need to reach me, add me on Facebook, you know, whatever. I would love to help you. And I also have a blog on Tumblr if you want to keep up with how I'm doing, and or look at my Instagram and whatever. I mean, I'm happy to help, and I'm really happy to share my experience. So thank you all for watching this. Please give me a like or share this video. It would mean so much to me. I will try and continue to make videos, since I seem to be getting a lot of good feedback. So if there's any video suggestions you really want me to do about endo or chronic pain in general, because I have more than just endo, you know, I would love to do that. Thank you so much for watching. Bye.